Why is levodopa the primary treatment for Parkinson's bradykinesia? Imagine trying to move through water that suddenly becomes thick and sticky. That's similar to what people with Parkinson's disease experience with bradykinesia, or slowness of movement. It can make simple tasks like walking, writing, or even speaking much harder. To understand why levodopa is the main treatment, we need to look at what causes these movement issues in the first place. Parkinson's disease involves the gradual loss of nerve cells in a part of the brain called the substantia nigra. These cells produce dopamine, a chemical that helps control how smoothly and quickly we move. When these cells die, dopamine levels drop, leading to the core symptoms of Parkinson's, including bradykinesia. Without enough dopamine, the brain struggles to send proper signals to muscles, making movements slow and stiff. Levodopa is a medication that acts as a precursor to dopamine. This means it's a building block that the brain can convert into dopamine. And like dopamine itself, levodopa can cross the blood-brain barrier, which is a protective layer that keeps many substances out of the brain. Once inside, the body transforms levodopa into dopamine, helping to restore the chemical balance needed for normal movement. Most of the levodopa taken by mouth is broken down before it reaches the brain, so it's usually given with another drug like carbidopa or benserazide. These medications block the enzyme that breaks down levodopa outside the brain, ensuring more of it gets into the brain and reducing side effects like nausea. This combination makes the treatment more effective and better tolerated. For many people with Parkinson's, levodopa provides significant relief from bradykinesia, stiffness, and tremors. The improvements can be quite noticeable, especially early on. However, as the disease advances and more nerve cells are lost, the response to levodopa may become less consistent. Some people experience wearing off, where the medication's effects fade before the next dose, or on-off fluctuations, where symptoms suddenly worsen or improve. Long-term use of levodopa can also cause side effects, such as involuntary movements called dyskinesias. Despite these challenges, levodopa remains the most effective medication for improving motor symptoms in Parkinson's disease. Other drugs like dopamine agonists or enzyme inhibitors are sometimes added or used earlier, but none are as powerful in improving movement as levodopa. Deciding when to start levodopa is a personal choice made with a healthcare provider. Factors like the severity of symptoms, overall health, and individual preferences are important. Sometimes delaying levodopa can mean living longer without certain side effects, but untreated symptoms can also impact quality of life. It's a balance that needs careful consideration. In summary, levodopa is the main treatment for bradykinesia because it directly replaces the dopamine that the brain is missing. This helps restore movement and reduce stiffness, making daily life easier for many people with Parkinson's. While it's not a cure, it remains the most effective way to manage the core motor symptoms. Always consult a healthcare professional to tailor treatment plans to individual needs and to monitor for any side effects or changes over time.